Let's take a look at some of the questions that are coming in for our viewers. For Dr. Jan right here, here's one. What are the risks and benefits of starting hormone replacement therapy post-menopause? It's from LD Peters.
Well, I love the fact that this question asked about both the risks and the benefits, because you always have to factor both of those as well as options and alternatives when you're talking about any treatment. Traditionally, most medical professionals talk to women about starting HRT, hormone replacement therapy, even before they go through menopause, right? Perimenopausal symptoms right around the time of menopause, average age of 51. It's much less common for a woman after menopause to say, should I be taking hormone therapy? Now, here's the good news. We know so much more about reversing that negativity that came out over 20 years ago in the Women's Health Initiative study that kind of turned the whole world against the option of hormone replacement therapy for women. So yes, even women who are 8+ years, 10+ years after menopause, if they're still having vasomotor symptoms, hot flashes, anything associated with low estrogen and progesterone, they should 100% talk to their doctor about pros and cons of starting it. Yes, there are risks, but there are also a lot of benefits.
Your prescription for wellness.
Okay, has to do with bone density testing, when to get that when we're talking about osteopenia, osteoporosis, which affects both men as well as women. Anyone who's lost significant height, yes, that does happen with age, but you should not ignore that. If you've had what we call a low trauma fracture, so something that shouldn't have broken a bone but has bone density DEXA test is pretty standard and easy to get. Someone who's been on long-term steroid medication, so this could be someone with a pulmonary condition like asthma, or if they've had acute or sudden hormone level drop at any point in their life. Average age for testing for women is 65. That's when it's recommended to start. I do not agree with that. I've always started screening my patients right around the time of menopause, but know your family history and those risk factors, super important.
What about men? When should men get screened?
There's no screening recommendation for men. So again, maybe we could do something about that, DeMarco, because men get osteoporosis as well.
All right, Doc, thank you very much. And folks, we would love to hear from you, so hit us up on Instagram with all of your medical questions for America's favorite doctor at ABC GMA3.